In eastern Turkey, nestled within the community, stood Bitlis Tafin State Hospital, a beacon of hope for the locals seeking medical aid. Like any healthcare facility, individuals frequented it seeking relief from ailments and injuries. The hospital staff, including Nurse Abuza, were renowned for their warmth and expertise in tending to the needs of those who sought their assistance. On an ordinary day, patients flowed in and out, each with their own set of concerns. Nurse Abuza's day commenced as usual, attending to the diverse array of cases that came his way. His first patient presented with a troublesome rash spanning his body. After a thorough examination and diagnostic tests, Nurse Abuza deduced that the rash likely stemmed from a reaction to a new detergent the patient had been using. Assuring the patient that the condition was treatable and would resolve within a few days, Nurse Abuza advised a return to the previous detergent. Though paperwork was not his preferred task, he diligently completed the necessary documentation to update the patient's medical records. Soon after, a woman entered Nurse Abuza's domain, bearing a severe laceration along the length of her leg. In the midst of the hospital's routine, a moment of unexpected intrigue unfolded when Nurse Abuza encountered an unusual visitor. The hospital's bustling corridors and treatment rooms had become familiar territory to Nurse Abuza, accustomed to addressing the diverse medical needs of the patients who sought assistance. One such patient, a woman, arrived with a distressing wound incurred while cooking in her kitchen. Nurse Abuza swiftly assessed the injury, determining that it required stitches to facilitate healing. With practiced hands and unwavering focus, Nurse Abuza administered the necessary medical care, skillfully suturing the wound, providing pain relief medication, and ensuring the patient's comfort before sending her on her way. Despite the gravity of such cases, Nurse Abuza remained composed, his years of experience enabling him to navigate through the challenges with ease. However, amidst the routine, an unexpected presence emerged, a small black and white cat, limping its way into the hospital and settling in the waiting room, its injured paw lifted delicately to avoid further discomfort. As Nurse Abuza attended to his administrative duties, the sight of the cat caught his attention, prompting curiosity and concern. The sudden appearance of the feline stirred intrigue among the hospital staff and patients alike, igniting a sense of compassion and wonderment at the unexpected visitor's plight. As the cat remained in the waiting room, eliciting various reactions from the patients, Nurse Abuza couldn't shake off the nagging sense of concern for the feline's well-being. Some onlookers found the cat endearing, while others regarded it with disdain, prompting mixed reactions among the hospital visitors. Despite the commotion, Nurse Abuza maintained his focus on attending to the patients awaiting treatment. With a steady stream of individuals in need of medical assistance, he couldn't afford to let the presence of the cat disrupt the clinic's operations. Surely, someone from maintenance would soon address the situation and relocate the animal. Amidst the flurry of patients, Nurse Abuza tended to a young boy with a twisted wrist, a common injury from a playground mishap. As he administered treatment, his thoughts drifted back to the cat lingering in the waiting room. Pondering the reasons behind its presence, Nurse Abuza wondered if the cat sought refuge from the outside world or if it required assistance due to an underlying issue. Despite the pressing demands of his duties, Nurse Abuza felt compelled to address the situation unfolding in the waiting room. With a sense of compassion driving his actions, he resolved to take a step beyond his usual responsibilities, propelled by an innate desire to extend care to all creatures in need. Completing his tasks with the young boy's wrist, Nurse Abuza swiftly attended to his paperwork before turning his attention to the cat still lingering outside his door. Despite attempts to coax it inside, the cat remained rooted to its spot, its gaze fixed on him with a pleading look in its eyes. Uncertain of how to proceed, Nurse Abuza grappled with the dilemma before him. Though trained in human healthcare, he lacked expertise in veterinary medicine. Despite his fondness for animals, the prospect of treating the cat posed a challenge beyond his usual scope of practice. With no other recourse, Nurse Abuza resolved to approach the situation as he would with any patient in need. Gently approaching the cat, he settled beside it, noting its injured paw held aloft. Recognizing the severity of the issue, he carefully examined the cat's injured limb, eliciting subdued vocalizations from the feline. Despite the cat's discomfort, it remained cooperative during the examination, allowing Nurse Abusa to assess the extent of its injuries. With each gentle touch, he worked to determine the nature of the damage, mindful of providing comfort and care to the injured animal. It was almost as if the cat sensed Nurse Abusa's intentions to aid it. The other patients in the waiting room were taken aback by the unexpected scene, with some capturing the moment on their phones. Witnessing a nurse tending to a cat in a hospital was indeed a rare occurrence. After a thorough examination, Nurse Abusa carefully splinted the cat's broken foot and secured it with bandages, hoping it would suffice until the injury healed. Remarkably, the cat remained calm throughout the procedure, even accepting a small dose of pain relief. As the pain medication took effect, the cat expressed gratitude with affectionate meows before gingerly making its way out of the hospital on its bandaged paw. However, this wasn't the last encounter Nurse Abusa had with the cat. Several weeks later, it returned, seemingly seeking a follow-up. Though the bandages showed signs of wear, they had fulfilled their purpose, aiding in the cat's recovery. Nurse Abusa's act of kindness not only provided assistance to an injured animal, but also touched the hearts of everyone in the hospital, leaving a lasting impression of compassion and care.